Welcome to our Alabama CBF Zoom conference call. We've been doing these almost every Thursday on different topics. And today has been a popular topic, going back to church. And we've had a couple of other states ask to join us. So we welcome our friends from South Carolina and, hello, Big Keithy, and our friends from the Heartland. So we have some people here from Kansas City and others. So welcome. We are glad that you're all here. I just want to encourage you to mute yourself when you're not talking. And that way we will shut out some of the background noise that sometimes tends to interrupt us. My associate, Lucas Dorian, is here with us, and he is going to continue to welcome people into the call who show up into our waiting room. But today we have want to talk about going back to church, which is the #1 phone call that I have been getting over the past week or two, which is, when do you think we can start back to church? What all do we need to be talking about? In Alabama, the lieutenant governor put out some information on small businesses and churches and going back to what will be a new normal for everyone. And so we thought, before we start talking about the details of what it looks like when we go back to church, we should probably start with the conversation of, should we go back to church? And what are the medical and emotional implications related to this topic? So today I am delighted to have 3 of my friends with us. And so Paul Bird is here with me. I happen to live with him, which is why he's sitting beside me. He is a pediatric chaplain on the hematology oncology unit at Children's of Alabama. We also have with us Malcolm Marler, who is the head of pastoral care at UAB Hospitals. Welcome, Malcolm. So glad you're here. And Dr. Heath, who is with us. And actually, Dr. Heath is a friend of Malcolm. So Malcolm, I was wondering if you could introduce her to all of us.
Yeah, I would love to. I've known Sonia Heath for a long time, almost 2 decades and maybe more, since the mid-90s, when I was a chaplain at the 1917 clinic, our HIV infectious disease clinic here at UAB. And Dr. Heath is also a person of faith who I appreciated so much, her willingness to speak with us and to give us some good guidelines and answer any questions we might have. And so Dr. Heath, I don't know, Terry, are you going to be asking some specific questions?
Well, actually, Dr. Heath, welcome. We're so glad to have you. And I was wondering if you could just talk to us as a physician and someone who's helping guide your church through this situation. I am wondering if you could just go ahead and present to us everything you're thinking medically and with your congregation about what it means to go back to church and when we should even begin to think about this conversation. And I'm just going to turn it over to you and let you talk for a while.
Okay. I'm going to talk for a little bit, and then I might show a couple of things on the screen here. So I go to Highlands United Methodist Church in 5 Points South, and several weeks ago, actually before schools closed, we started having discussions in our church about what COVID-19 was going to mean when we had our first case in Alabama and how we were going to keep our congregations safe. But also, we have a child development center, and we have a lot of community ministries where we provide food and mail services and laundering services and a lot of other services to homeless people. And so we began having discussions very early about what this was going to look like. And we really quickly closed our doors and opened our virtual church services, we actually continued to serve our community ministries longer than we did congregate in our church for church services, recognizing that that was still a very important part of our mission. But even that has been diverted to other places. And we talked a lot about, different populations in our church that were of particular risk for COVID, and how we could be with one another and love one another without putting each other at risk. And I think, whether we think about our church, or we think about our child development center, or we think about our volunteers in our community ministries, it's oftentimes older people, some of whom are retired, some of whom have, various illnesses that may put them at higher risk, that those are sort of the backs of the people that are the foundation of all of the services that our churches provide. And so I think, one of our questions is sort of an outward question of when are the doors open and we're inviting people back in. But the other is a question of how do we protect those that we love the most. And I also like to consider, we may be ready for our families with young kids and, middle-aged parents to be ready to come back in, but it's hard to say, don't come if you're over the age of 55 or 60 because you're at higher risk, and just sort of the messaging around all of that. So at our church, we've been having these discussions, and mostly I've just been giving guidance to people on how to think about it, not necessarily on what I think the answer should be, because I think a lot of people need to make decisions on their own. I think we can talk about practical advice, and then I think each church family needs to figure out how they might be able to do that in their church. So one of the things that I think is key for starters is, can you practice social distancing in your church? Social distancing is 6 feet away from your friends. So a family could be on one pew, but the next pew is probably not safe, and I'm not even sure about the next pew after that if we think about a 6-foot radius around everybody. Masks are great, but masks are not an allowance for you to break the 6-foot rule. So if Malcolm has COVID and he's asymptomatic, and I bring my son into the church who has Crohn's disease and is on a biologic medicine, Malcolm may not realize that he could make my son sick and have to go to the hospital. So we still have to keep that 6-foot distance, even if we all wear a mask. So, for example, at our church, we realized we have 2 places where we congregate. One is a small chapel for our 8:30 service, and then the other is the large sanctuary. And we decided, the chapel's probably not going to be a safe place for us to bring together some of our oldest congregants for 8:30 service, because social distancing in that chapel is not really feasible. So I think those are some of the decisions that each individual sort of church council needs to make, because that's just sort of a logistical thing. If I took a tape measure and measured out 6 feet, which of the pews could people be in and which of them could they not be in? I have not enjoyed passing the peace any winter season for decades, but my church loves to pass the peace. We love to hug. We love to give sideways hugs. I don't think this is a time when we should give people the opportunity to pass the peace, because we're loving people and we just want to go and hug and touch people, and it's hard to keep that 6-foot distance. I also think we need to think about our choir. We have a choir loft that has probably a dozen people on each side of our choir loft, and I don't know how to have 6-foot distancing in the choir loft and to keep those people safe. And certainly there's plenty of people in our choir who are of older age. So I think about that. Are there creative ways that we can still enjoy music as a part of our service without putting our choir at risk? Communion is a big one that our church wrestled with. David Rogers, who is at, he's one of the wellness officers here at UAB, but he's also a surgeon at Children's Hospital, and I both came down pretty firm on communion being something that did not allow appropriate distancing, and that dipping a wafer into a cup of wine or grape juice was a hard thing to regulate, hands touching the rim and everything else. And so I think a lot of people in our church were a little heartbroken about that. But after they kind of sat on it for a while, I think they realized, yeah, I don't really see kind of a workaround to this. So those are some of the things that we've sort of talked about in our individual church. We also talked about things like hymnals. In general, we think about surfaces like metal or plastic. The virus can stay alive on it for anywhere from 1 to 3 days. So you might feel comfortable with a week in between services. Sunday to Wednesday and Wednesday to Sunday might be a little harder. I also think we need to be friendly to our earth. So I'm not a big fan of printing out everything and then recycling it. So I think sometimes perfection is the enemy of good enough. I wasn't necessarily way concerned about hymnals, but I think it's important for everybody to kind of think about. I do want to share one thing when we think about timing. I'm going to see if I can pull this up on my computer while we're talking here. I don't know if there's any sort of budding epidemiologist in your group, but there's a website called Bama Tracker. I'm going to see if I can share my screen. Do you guys see that? Can anybody see the graphs? Yeah, okay, I see head nods. Okay,
Yes.
So this is called Bama Tracker. And one of the things that you can do on this is you can look at new cases per day, and you can look at test reported per day. Now, there's a lot of other graphs on this, but I don't think it's important that we get into the weeds of a lot of other graphs. But when you hear people saying, we would like for there to be a decrease in the number of cases of COVID for about 2 weeks, with a plateau or a decrease before we think about opening up Alabama, this new cases per day is what we're looking at. So you see the case number here on the y-axis and the date here on the x-axis. And we had our first case on March 13th, and now we're out here. This is yesterday. And what you can see here is that we kind of had this sort of upward trend, and it seemed like we peaked here. And then it seemed like we went down, but wait, we went back up. And then we went down, but wait, we went back up. Then we went down, and everybody was getting excited because we were starting to have a plateau. But you see, this is a plateau over 5 days, not 2 weeks. And then we've started to go up again and up again. And this last one is 283, which is as high as some of our highest points, in the last, early part of April. So as you're trying to make decisions with your church community, I think when we're trying to answer questions of the congregants, you can tell them that you want to watch this data very closely with the Jefferson County Health Department, with the state health department, and that we want to see both a decrease, a plateau, a leveling off over time before we consider opening back up again. And we want this decrease to be persistent for at least 2 weeks. And why do we want this? Because when we're at these high points up here, that's when we stretch our hospital too thin. And all of the social distancing that we're doing in the sheltering in place at home right now is all because we don't want the hospitals to overload. If Malcolm gets sick, I want to be able to give him a ventilator if he needs it. In Italy, if I got sick and Malcolm got sick at the same time, I would get the ventilator and Malcolm would get comfort care. And we don't ever want to make that decision here at UAB or any of our hospitals in Alabama. So when we look at these numbers, we're really trying to say, what is our hospital capacity? If you get sick, do we have enough ICUs and ventilators to take care of the sickest? And all the while we're doing this, we want to see this reported test numbers go up. These days where it's like 0, this is probably some problems with reporting, but in general, Alabama needs to be testing more to know really how we're doing. I'm going to stop sharing my screen here in just a minute, but I do want to show one other thing on here. Yesterday was the first day that Mobile County had more cases of COVID than Jefferson County. And this is really kind of worrisome for us because Mobile County has 2/3 of the population as Jefferson County. The other thing you'll notice is if I hover over Jefferson County, we've had 31 deaths in our county. If I hover over Mobile, they've had 38 deaths. And so they have more people infected with a fewer population and more people die. We've also had a number of smaller rural counties like Lee, Chambers, and others, Etowah, that have had outbreaks. And we currently now in Alabama have several nursing homes with outbreaks, one veterans nursing home with a lot of infected people and employees, and also evidence of cases in our prisons. And every time we have an outbreak in a very confined population like that, we will see our numbers rise in fast number of days. And so I'll stop sharing because I don't want to overload with a bunch of data, but I do think that data is what is important for us to make the decisions. That, this is not a decision of us wanting to keep the doors to the church closed. It's not a decision of wanting people not to have a job or have small businesses go down. It's not a political decision. It really is driven by data, and we really want to provide the best care. I'll mention a couple of other quick things, and then I'll kind of let you guys ask some questions. At our church, we are thinking about opening up our community ministries earlier than our church doors to our congregation, because we are all privileged to live in houses with heat and a healthy person to go to the grocery store and buy groceries. And some of our communities even have, little drive-by, pick up groceries for free at this person's house if you're hungry. But our communities where people don't have food need our help more than ever. So when we're making decisions at our church, we're thinking about how can we have a bagged lunch where we can open the door and hand out a sack lunch, where we can say social distance on the sidewalk and only have one person come up at a time. How can we support our child care center so that when it's time for them to open up, we can protect the workers in the child care center and the employees that have to go back to work so they don't lose their job. So I think we are amazed at how comfortable everybody has become with services on YouTube or Facebook or what have you, encouraging our youth to teach well, in some cases, older people are better with social media than the younger people. What am I saying? But helping everybody get connected to church in whatever way that means. And we're trying to help with a conversation, but we don't have the answers. So those are just a few of my thoughts.
Thank you so much, Sonia. I'm so grateful, and exactly what I was looking for was some of the information. And I think that the tracking information is so incredibly helpful. Before we open up for questions, I want to give Malcolm and Paul an opportunity to respond to some of what you've heard. And I'm thinking specifically about how do we talk to our church families about the decisions we're making and why, knowing that their emotions are involved when it comes to faith, their faith community.
Hmm. Well, it's a different time, isn't it? I've been a chaplain here at UAB Hospital for 26 years, and we've never seen anything like this. So I think for me, the things that we all miss as clergy is what we said a little bit earlier, is that we are a touching people. We want to care for each other and reach out, and that's been one of the hardest things about us visiting patients and families. Actually, we don't see many family members right now because they can't come into our hospital unless we have a very critical situation. So, but I was visiting, I'm just going to tell a quick story. I was visiting yesterday with a patient, his family, who 2 family members were allowed in palliative care because this patient has days, hours to live. And so I was with the family. We were social distancing the 2 family members, the wife and the adult son. And as we talked and they shared their hopes and their appreciations of lots of things about their family member, at the end of that, we wanted to connect in ways we normally would. And even in having prayer around the bedside, my chaplains, we are not allowed to touch anybody in a room. And we always wash hands before and after and all of those things. But I'm just here to say, my wife is a clergy person as well in a congregation, and we know firsthand how challenging this is. It's really about, to me, in my mind, how do we love our neighbor in a new way? And I think I even get a little emotional, and I can feel it in my throat when I say that, because I want to love my neighbor the way I've always loved my neighbor, but right now I've got to love them in a different way and explain why. And the biggest challenge I have is having to use words almost exclusively in caring for people in pastoral care. And normally I would use a lot other ways to express that. And right now I would just say that this is a new day of how do we show our love through words and through respecting, caring for people. So, Brother Bird, Paul, what would you want to add to that?
Thank you, Reverend Malcolm. So I don't know if I've got a ton more to add. And I'm not sure that chaplains are probably the best to talk about going back to church and what to think about as far as going back to church. But I think that my experience in the hospital may be uniquely qualified to speak to a couple of things. So I'll try to speak to the things that I know about particularly children and families regarding this change in the way they think about church. Children really are affected by this. They're affected because children are creatures of routine, right? And that routine has been really upside down. Those of you with children at home know that more than we do. It may be a special and fun time, but it's also very deeply unsettling because the things that they know, their anchors, have been moved. And so being able to provide time before, well, I guess rushing to tell them we're going back to normal, or even trying to present to them what a new normal would look like before we have some real clear understanding of that, I think is that it's too early to do that. So I would say letting our children know sort of where we are and what our plans are right now, but not trying to project too far ahead. That's the biggest thing. For our cancer families, this idea of social distancing is not new. It is one of the first things that families with a child with a diagnosis of cancer, leukemia, those kinds of things have to learn to do. And we see children really buy into it. They understand some of the social distancing things. They can learn to wear a mask. They can learn that when people come over, they have to gel in and gel out of their home, and that nobody sick can come over. They learn those things really, really well. But they don't do so well putting them in social situations and telling them to keep distance. So that idea of rushing to get children back together at church is going to be really hard. So my suggestion is, number one, not rushing to tell children this is when we're going to be back to church until we know that, and trying to present some type of routine here and now to them. So I'm loving what I'm seeing churches doing with Zoom phone calls, with activities that they are looking forward to, that become a new normal for them, that can be really reassuring. And the other thing that I would say is, well, two other things. The first one is children are really good at observing and taking in information. They're really not good at digesting that information and coming up with the right understanding of what they're experiencing. And they're even worse at expressing to us what they're thinking. So providing times and even guidance for families to listen to their children, to listen to their thoughts and their fears about this, to providing community time as families and guiding families to talk about those things with children, really, really important, and can be really neat bonding times with families. The other thing I would say is this is a time when children are uniquely empowered to give care. The power of children to connect with somebody else over the internet, I know for my mom, hearing from the grandkids blows her away. I know for me, going to church, since children aren't in our home, and connecting or going to work and seeing children and seeing their livelihood really helps, connecting in those ways. So I think that this is an opportunity as we change paradigm to empower kids to be a part of giving the care that is not touch, but it is about connection. And that's what I've got. I guess I don't want to talk for too long, but those are my thoughts.
Thank you. We have time to for you to ask some questions, and just want to remind you that if you have a question to ask, if you would remember to unmute yourself and ask your question, and we will let everyone try to respond to those questions. So, do you have questions?
There's one in the chat. So I guess there was one privately to me, but I'll go ahead and answer it publicly. Is the higher death rate because we have better health care in Birmingham? I do think that our critical care in Birmingham is probably, the best in the state. And, we actually have rates that are better than, some of the hospitals around the country, partly because UAB has done a really good job of increasing the number of COVID floors to ensure that the physicians are not overwhelmed with high numbers of patients. You can imagine that it is very, very hard and stressful to take care of these patients. And so if you double your census and take care of twice as many, the care is going to go down. There's also some things that require a high number of providers, nurses, other care technicians. Proning is something that we do at UAB, which is putting patients on their stomach instead of their back. But it takes like 8 to 10 people to turn a patient on a ventilator onto their stomach safely, and you need a special kind of bed. And a lot of our rural areas do not have that capacity. So UAB is very fortunate to have both the staffing, and we ramped up fairly quickly from 1 ICU for COVID patients to 4 ICUs, and 1 floor for patients for, that were not in ICUs to 5 medical floors for COVID patients. So the command center at UAB has really done a great job at preparing. So there's a question of, do you recommend church doors, offices open, even though we aren't ready for going to worship? I guess I would just say, is there something that needs to happen in a church office that can't happen from a home? I don't know if Sharon wants to comment on that, because she posed the question.
I don't know. We were just talking about when small businesses open, the church has been very gracious to pay all of us. And of course, the ministers have all been working as hard or harder than normal, but not everyone is able to do their job away from the church, whether it's custodians or kitchen staff and things like that. And, could they come in and maybe make meals for either people that were hungry or even just senior adults who want to drop in and pick up a curbside meal, things like that. We've talked a lot about not necessarily changing from live stream, but should the church itself be open when small businesses are able to open?
I think it depends on what the purpose is. So if you can social distance and you can social distance and you're providing, a necessary task that can't be done somewhere else, maybe that's reasonable. But I also think you have to be careful, because I don't think we should have a 65-year-old nursery worker come in to take care of little kids because the parents would like to sit at church without being bothered during the service.
Right.
It might be a blunt way to put it, but I think necessary is a key part of this. And I think we've all discovered certain workarounds. So, even in our community ministries, we've tried to think about, how do we make food? How do I get the Boy Scouts to make a bunch of peanut butter and jelly sandwiches and put them in bags and then take them to the church and someone can pass them out? So I think it all has to be individualized to the church, and you have to think about who your church workers are, and or the employees, and then you have to decide, is it worth it for a certain person of a certain risk category to go and do this task if it puts them in harm's way?
And what about realistically childcare? We're not even talking about church nursery, but we have a fairly large childcare center that's been closed since March 13th. But are you thinking another month? When are you thinking that First United Methodist will open their care?
So I have not said any dates because we haven't even gotten to the point where 2 weeks we've decreased in the numbers and we plateaued for a full 2 weeks. So I'm not even speaking yet in dates. When we get to the point where we're at like 7, 8, or 9 days, then I think you might be getting closer to saying, okay, I wonder if we can open in a week or something. But I don't, the 3 days ago, the plateau looked real. And then, the last 2 days have looked not so good. So the other thing at our church that we've said to start looking at is, number one, who are the childcare providers? We have a lot of elderly people that provide childcare at our church. Number two, there is likely going to be sort of square footage recommendations. So like if you have a restaurant, how many people can you fit into the restaurant? How many tables can be in the restaurant to allow, a certain amount of social distancing? And you can do similar math in each of your rooms and say, okay, well, in this room, I normally have 2 teachers and 20 kids. But in order to have social distancing, I might need to have 7 kids. And then we have to think about the 2 adult rule. So if I took my 20 kids and divide them into 10 each, am I allowed to have a single childcare provider with 10 kids? Well, that goes against our safe sanctuary policy. And so then at our church, we talked about, well, we have all of our Sunday school classrooms on the 2nd floor. What if we converted some of those to, secondary classrooms for the child care center? But evidently for the child care center, you've got to be on the 1st floor and you've got to be able to climb out of a window or exit like to a floor level. So that's not allowed. So those are discussions that we're having. And I just kind of put forth to the Child Development Center, you need to think about how many people you have in a room and how you can social distance and how you can do safe sanctuary. And then also ask the question of families, everybody wants to get back to work, but who really needs to get back to work? And is there a way where you could say, we don't think we can have 20 kids in the classroom all day, so we're going to have an A group and a B group. And the A group gets to come from 7 to 12, and the B group gets to come from 1 to 6. And we're going to clean everything in the middle of the day. Remember that metal surfaces can have the coronavirus on them for up to 3 days. So when we think about our little ones going into the restroom and hopefully cleaning their hands, but then turning off the faucets, door handles, whatever. So I think I have kind of given some things to think about, but I haven't necessarily told them, well, this is the day you can open and this is how you can open. I've just asked them to think about some things about social distancing, about an A group and a B group, and what that new normal might look like for a while. And then also recognizing that the families need to consider that the child care center is going to do the best job that they can, but that's not a guarantee that your child can't come to the child care center and get COVID. Mm-hmm. So, yeah. Another question?
So, Sonia, yeah, my name's Taylor. So I guess this is a question for Sonia and or Malcolm and Paul. When we do eventually reach that 2 weeks, that 2 weeks of a decline, what does it exactly mean to reopen our church doors for worship? And the reason I ask that is I imagine that when we reach that 2 weeks decline, we're still going to need to practice social distancing, I'm assuming, correct? So it's not like it's just a free-for-all and it won't be a switch. And so kind of a follow-up question for that is, when do you think, and this isn't a date question as much as it's a conditions questions, like what are the conditions for when we can worship again without social distancing? Because in my head, I'm thinking that probably won't happen until we have a vaccine that is produced and then distributed on a mass level, which I'm going to continue this logic, which means we've got probably a year, if not more, of being in this some sort of like flux zone. So anywho, those are kind of my related questions, and I just wanted to get your all's thoughts. Not so much dates, but yeah, what does it mean to reopen our church doors when we reach those 2 weeks of decline?
So one of the things you guys may have remembered, it was about a month ago, we first heard that you could not congregate if it was 250 people or more. And then it was 100, and then it was 50, and then it was 25, and then it was 10. And now you can't even have a funeral or a wedding or anything. And I imagine that we will come back up in a similar way. I would think that our church groups should not think initially about when can we all congregate together in the sanctuary together, but when can we start to have small groups again with adequate social distancing? When can the men's group and the women's group and the youth group come together in small groups, in large spaces with social distancing? And then when that 10 becomes 25 and that 25 becomes 50 and that 50 becomes 100, when do we feel like it's safest? And I won't comment more on this because you heard my comments earlier. I'd love to hear Malcolm, but I really feel strongly about the compliance of older people not to come to church. So if the recommendation is that people over the age of 55 or 60 or with comorbidities don't come to church because they shouldn't be in areas where people are congregating closely together, and you open the church doors and say, come one, come all, how well are those people at greatest risk going to follow the mixed messages? And are we all okay with that if they show up at our church and they get sick? So I think we need to think about a policy where we come back up in a way that we went down, that we come back up in groups of 10 and 20 and 50, and that maybe, like you say, we focus on thinking about good strategies for treatment and vaccines before we have 500 people in the same space saying, my family will scoot over a little bit more so that 2 more people can fit in this pew with me. Malcolm?
I think you're right. I think one of the ways we have done it on our own chaplain team here is that we identified, according to CDC guidelines, who were the most vulnerable on our team to catch this. And then we gave us different tasks. Some of our chaplains for the last 2 weeks have not been allowed to make any patient visits and to do all of their visits virtually from their office here at work or from home, mostly at work. And they have either Zoomed in or used an app that we have to video call and have a chat with, especially family members. But my point is that for a while now, we have restricted our chaplains based on our own risk, whether it's our age or whether we've had heart troubles or if we've had respiratory issues or whatever comorbidities we call them in the hospital, which are just simply a way of saying multiple health issues. And so trying to think about how not to exclude them exclusively, but to ask them to stay at home and let's do other things to reach out to them. Not to say you can't come to church because you're 65. We want to say, okay, for those who are older, what can we do in virtual ways or through any creative, I think the church is very creative when we see that, okay, well, what are all the different ways we can do this? So I wouldn't prescribe that for anybody, but I would just say we can be creative with our senior adults. And I'll just stop there.
And I would just say the same thing in our hospital. We benched some of our older ID docs because I don't want to see them die.
Yeah.
I'm not, I'm working for employee health at UAB, which is not my job, but I'm calling people who are positive, and I'm not ready to see people that have mentored me for the last 20 years on the ventilator. And so when we think about coming back to work, and our nursery workers, our child care center workers, our choir members, our organists, we need to be real thoughtful about what we're asking them to do.
Mm-hmm. And I would just add that one of the things we focus a lot on the older because this has impacted a lot of people who are older, like me. And so what we try to do is to say, what are not only the innovative ways we can reach out to them, but how can we, I don't know, I don't want to repeat myself, and I think I'm about to, but I think the understanding that it's not just the older, but it's with people with very specific health issues from their life that no matter what their age is, if they've had a stroke, or they've had they have congestive heart failure, or if they're a COPD, or whatever it might be, no matter what your age, if you have you just look at the CDC guidelines in terms of those kinds of illnesses. So I would just say let's don't focus only those on our senior adults.
I wanted to bring up two questions that have come up in the chat. One is, what do we imagine may never be the same again when we all come back together? And then Dr. Heath, there has been conversation in the news in the past couple of days about a resurgence in the fall or winter of COVID, and what that would mean for all of us. I'm guessing that means that we're looking at the situation we're in right now, coming back around a second time.
Yes, you guys I'm going to go with the second question first. You guys may remember when we had the avian influenza in 2014. We had evidence of flu very late in the spring. And then in August, it came back. And by September, it was bad. And it was bad the whole season. Next fall and next winter, we need to watch things very closely. Not only are we still going to have, right now we have 0.1% of the Alabama population has been infected with COVID. That's just what we know. A lot of people haven't been tested, but that's what we know. So the majority of people have never had COVID, and it will continue to circulate at low levels. It'll increase at certain times, it'll decrease at certain times, and UAB is already saying no summer school classes and possibly no fall classes. The thought of having a bunch of kids in a dorm, how do you social distance? It's like the opposite of college, right? So I think the other thing is that every year we have seasonal influenza. And so next year, our hospitals will not only have COVID, but we will also have another seasonal influenza outbreak like we do every year. Right now, we see evidence that COVID is at least 10 to 20 times, if not higher, in mortality compared to regular influenza. Some reports say as high as 40 times higher mortality. So, again, we will be looking at the same types of strategies because we will be worried that our hospitals are going to hit that surge capacity with 2 illnesses, at the same time. So we may be asked again to limit our interactions to decrease the surge in hospitals. Malcolm, do you want to comment on what will never be the same at church or in hospital visits?
It's kind of like
you have the crystal ball. I don't have that.
somebody asked me the other day, what advice would you give? I'm going like, oh man, I am not a good advice person because mainly I don't know. I think asking one another that question is really a good question because it helps us to reflect on what good could possibly come out of this. I think anytime being a Baptist preacher's kid and a grandson of a Baptist preacher, the church has been such an important part of my entire life. And I think if there's any advice I could give would be to keep asking the question, what do we need to keep and what do we need to let go of? It's just a basic thing, and always looking for how can anything good come from this crisis? We're already seeing a lot of things, whether it's neighbors actually learning the names of their neighbors and helping one another and asking and communicating. But I think as a chaplain, when I see people in crisis who can, there's a time where you can only focus on the hard and the bad and the part that's so difficult because it's not what you want. But there are things with time that we can go, wow, I really learned a lot from that in this way. And so just keep reflecting on that. My mother died suddenly when I was 10 years old, totally unexpected. 10-year-old kid, daddy was a Baptist preacher in Montgomery. And there's no way as a 10-year-old I could even ever imagine that the death of my mama would ever have anything good about that. And I can tell you now, 55 years later, that the love that church provided to me is the foundation of why I walk towards crises now. And so I think for me, the way that church loved me and my family during a crisis still impacts my life. And I've been picking up the phone this last week, calling some of them that I haven't talked to in 50 years and just saying thank you. So that's about the best I can do.
Thanks, Malcolm. Let's do one last question, Hannah.
Yeah, so one of the things sort of rolling around in my head is that we're going to be living in this liminal space for probably 18 to 24 months. And no matter what we do, there are going to be people in our congregation who are significantly at risk. And we have several children in our church who are high risk. So I'm thinking, not just in terms of the elderly, but people all along the spectrum who are at risk. And so I was sort of curious to hear our pediatric chaplain talk a little bit about, in my head, one of the things that is just sort of rolling around in there is, do we need to maybe look at the next 18 to 24 months as an opportunity to sort of set this schedule that could maybe stay the same for children, even when we have to go in and out of times of social distancing? And I think a lot about sort of the beauty of how that's going to empower parents in a way that is very different than we're used to at church. So I was sort of curious to hear you talk about the benefits of maybe creating this schedule for children and families, or for even the whole church, where we can kind of live into that even in and out of social distancing. So just kind of like, how do we allow ourselves to be in this liminal space and accept that this is kind of the way it's going to be for a while? So does that give you enough? I wanted to hear your thoughts on that.
Well, no, I think this may be an example of when the question starts its own answer. I think you're right. I think you're exactly that with how children do so well with structure, trying to imagine what a new structure looks like and have fun with that, but not try to say we're doing this until we get the new normal, but making a new normal with them and with families so that they can invest in that, and so that we can invest in that, really is helpful. So for us, this is going to be 2 months, 6 months, 24 months. I think that's a reasonable thought to be thinking. But for children, this is going to be a huge block of their life, right? If you think about events that happened when you were little and how big that was, this is important to start establishing some of that new normal. So what can we do? We can help families. What we do at the hospital, what I'm able to have conversations with families about is, okay, for this 2 years, your child's going to be in treatment. You're not going to be going back to church the way you were. How do you set up a routine at home that starts looking like that? Do you have a time that you do family devotions? Do you have a time that you do family worship? Setting up those times and parameters. And as I was saying earlier, do you have a time that you are reaching out? Because Mission Friends is there, right? And that's huge. Empowering kids to do something and helping them know. Now, it's not going to be writing a card and sending it off, because you don't want to send coronavirus in the mail. So it does take a lot of thinking creatively. And I don't have all those answers, but boy, when you look at some of the families in your church and how they've done those things, when you look at those at-risk families and start letting them teach you, it can be really, really helpful. So I'm actually really anxious to hear what creative ideas come out of this for families, because I do think it's important, but it's also kind of exciting, because I think that we will come away with a new way of looking at things that will be potentially very life-giving for folks that have not been able to connect it for a long time, that we've underserved. Does that answer your question?
Okay, friends, we've been on together for an hour, so I want to thank you.
Can I say one more quick thing?
Sure, yes, please.
I just wanted to say that I agree with sort of the points made about, some at-risk children, other people who maybe are not in older categories that are at risk. I know of people who have already said when our church opens the doors again, they themselves will not come back to the church physical. They want to continue to have the Facebook services and all of those things. So, continue to think about ways to give those options, because you are going to have families that need that. And the other thing I kind of put into the chat is that we've had a couple of town halls that I've been a part of, also with David Rogers, who you guys may know again from Children's Hospital. And we're going to do one for our child care center. The church family really trusts the information coming from you guys. And in a world where we're in like this circular vacuum of news cycles, and it really is helpful to have kind of a community that you feel like is getting trusted information. So, you know, as you're inviting people into these conversations, consider doing that. I know I've also started doing this for our Boy Scouts group, and initially there were several fathers on the group who didn't understand why we couldn't take, you know, hikes together and, you know, drive over to Georgia and stop at 2 places for fast food and do all this stuff. And literally over the course of an hour, you heard people say, well, I've never really heard it said that way. That makes a lot of sense. I still have to work in the community with my job. I would hate if I was the one who brought, you know, an infection into our scouting group. So the church has always been a place where you trust and love one another. And so if your churches are able to have programs like that, I think it would be very welcomed by your communities.
Thank you so much, Dr. Heath. Dr. Heath, before you go, and Malcolm and Paul, do you have any last words you want to share? Was that your last word of wisdom, Dr. Heath? It was? Okay. Malcolm or Paul?
Go, Paul.
I'm good.
No, I just thank you so much. It's so amazing and wonderful to me that that you have a group that you can come together like this and just talk together instead of just going, by God, we're just gonna do this no matter what. So I am thankful for you and for listening ears that goes to your heart. And so thank you very much. Appreciate your invitation.
Thank you. Friends, I want you to know that I am serving on a task force that CBF has created to produce resources and materials for churches related to this very topic, how to think about when we go back to church, and some of the thoughts and processes and resources that we can develop on a broader scale to help all of our states and regions and our churches to think about these issues. So that group is going to start meeting this afternoon. So I will keep in touch with you about those resources as they become available. And we will continue to have weekly conversations related to topics that you are sending to us that you're interested in having. And so I thank you for your time and your attention and the feedback that you give us about what you need to hear. And so as we go today, I would love to close us in a word of prayer, if you would like to join me. God, we are so grateful to know that no matter where we are, what we're going through, what our situation is, that you have promised that we are not alone, that you are with us. And being in this community lets us know that we are not contemplating all of these big life questions by ourselves, that we have each other, and that you are present with us. And for that, we are so incredibly grateful. And today I want to thank you so much for the healthcare providers that are working with those on the front lines who are sick and who need you the most. May we be instruments of help and peace to them, and we pray your blessings and your protection over them. And God, for all of the ministers from all the churches that are represented, we ask your blessings for them, for peace in moving forward, and your wisdom in knowing how to be the presence of Christ in their own community. For all of these very good and beautiful things, we give you so much thanks. In the name of Jesus our Christ, amen. Thank you, friends. So glad you were with us. I will be sending some follow-up information to you, and we'll see you next week. Bye.
Hey, Terry, did
Yes,
you record this?
we did record it, and we will